Hello, this is Dr. Laura Tigler. Welcome to my channel. This channel is meant to provide some good basic medical information. It's not meant to provide specific medical advice. Please do see your primary care provider or your primary care doctor to obtain medical advice that's tailored specifically for your needs. At the end of this video, I will provide some spiritual information. If you do not want to see that portion of the video, at the end of the medical information, I will let you know that the medical information portion is finished, and at that point you can simply click away. But please first do like and subscribe. So the last video, we talked about hypertension, which basically means chronically elevated blood pressure or high blood pressure over a period of time. We do not have a cure for that condition. I gave some basic information and I talked about medications to treat high blood pressure. But today we're going to go a little bit more in depth. As I mentioned in the first video about hypertension, I'm using the journal article from the periodical American Family Physician that was published in October 2023 as a basic outline for this talk. Okay, so we're going to talk about pharmacological interventions and what thresholds of blood pressure we should treat. And there are many different caveats, many different guidelines as to when to treat blood pressure and how. I'm just going to remind the viewer, in case you didn't catch the first video about hypertension, that because there is no cure for hypertension, the two main treatments we have are lifestyle modifications and pharmaceuticals, which means medication. Lifestyle changes and medicine. So we're going to talk about screening and diagnosis. I mentioned in the first video that a good place to go for guidelines, general good guidelines, is the United States Preventive Services Task Force. There are many different guidelines. You can go to, for example, my professional society, which is American Academy of Family Physicians. You can go to familydoctor.org to get that information from a patient point of view. You can go to American Heart Association, etc. But the basic guidelines for all doctors in the United States is the United States Preventive Services Task Force. And it recommends that we screen for hypertension or chronically elevated blood pressure starting at the age 18. Please do keep in mind that children can have elevated blood pressure. It's a bit more complicated how we screen for that. So I'm not going to go into pediatrics today. So I am going to stick with adult evaluation and treatment. So blood pressure can be monitored using an oscillatory method. Typically you'll remember seeing in the doctor's office a little red, almost like a pipette or a cylindrical column of mercury. And then we'll use the stethoscope and place it on your brachial artery, usually. The brachial artery, can be other arteries. And we'll have the stethoscope measuring for a beat as the cuff is released, and we can appreciate the pulse of the blood going through the artery. Another way to measure blood pressure is an oscillometric device. So that's a device that's typically available over the counter, and you don't need to use a stethoscope. You don't need to appreciate the pulse of the artery or hear it through a stethoscope or a tool that doctors typically use. The machine will do it for you, and it doesn't listen for the pulse or the beat. It actually feels or senses the vibrations that your arterial wall makes when the blood pulses through it. So isn't that interesting? So the first method is by listening to the sound of the beat, and doctors or providers usually do that method. And the second method, the oscillometric device, is the device that's commonly available over the counter, and that's actually appreciating the vibrations of the arterial wall, the wall of the artery. Anyway, that's interesting. So for the cuff, which is that piece of fabric, you could think of it, that we wrap around your arm, The part that actually inflates when we build up the pressure, that's called the bladder, cuff bladder, and that should encircle 80% of your arm's circumference. And that's because if it's too small, if it's less than 80%, then you might overestimate the blood pressure. You can get inaccurate blood pressure. So it does matter what the size of your arm is and also what the shape of your arm is. As I mentioned in the first video, and actually in other videos, the patient should sit quietly for about 5 minutes before we check the blood pressure. So the patient should be sitting quietly in a quiet place for 5 minutes in a chair with their feet on the floor. Their feet should not be crossed, and their arms should be supported at heart level. Now, just as an aside, very often in the office, the patient's arm might not be at heart level. So sometimes the patients get confused. Oh, you're not doing it right. But what will happen is if the medical assistant checks your blood pressure and the blood pressure is normal and your arm is lower than your heart rate, then you've already achieved the goal. It's just that if your blood pressure is a bit elevated, oh, okay, let's try for the true blood pressure. Wink, wink. Let's get the normal blood pressure if we can. Let's put your arm at the heart level. So at the doctor office, your blood pressure should be checked at least 2 or 3 times, about 1 to 2 minutes apart. Sometimes what we'll do is check it twice, 5 minutes apart. Any of those methods are appropriate. If you are at low risk for hypertension or other chronic medical diseases, it might be the fact that we'll just check your blood pressure once. And as long as it's normal, we'll be satisfied that we're not missing something serious. For an accurate diagnosis of your blood pressure measurement, you should have a blood pressure averaged over 3 or more separate visits. Now that is true, but sometimes if the blood pressure is high enough, or we call it stage 1, stage 2, etc., we'll initiate treatment for hypertension sooner than waiting for, say, 3 visits. Let's say it's 2 visits, and then we'll be asking the patient to change their lifestyle habits for about 3 to 6 months. And if lifestyle modifications or improved lifestyle habits aren't sufficient, are not sufficient to control the blood pressure, then we might go ahead and treat the patient with medication. So it doesn't have to be 3 separate visits. It sometimes can be just 2, and in rare cases, sometimes just 1 visit. And that can depend if the patient themselves have been checking their blood pressure and present to us a reliable blood pressure log that confirms that they do have chronically elevated blood pressure. So ideally, we would confirm that a patient has chronically elevated blood pressure that's been measured in the medical office by giving the patient an ambulatory monitor. And that's just our word for it. It's not exactly a good description. It's a special monitor. Ambulatory just means that you're not confined in the hospital. You're not laying down in a hospital bed. You're able to walk around on your own. But checking the blood pressure from a device you've bought over the counter, it's also ambulatory. So in a way, the name of this method isn't very well described, but it's an ambulatory monitor that we doctors give to patients to check their blood pressure in their home setting. That way we can confirm that the blood pressure really is chronically elevated. So studies have shown that that is the best way to confirm if a patient has hypertension. It's not always possible, however. And then you can still buy the over-the-counter blood pressure machine, and please do keep a good blood pressure log. All you have to do is have an 8.5 by 11 white piece of paper and a pen or pencil. Write in the date and the blood pressure, maybe what you were doing or what you were eating beforehand, and then write all the blood pressure measurements that you've taken. A lot of times patients ask, well, how many times should I do it per day or per week? I mean, in the ideal world, I would have your blood pressure measurement very often in the course of just 1 day. And then you would write down everything you had eaten and everything you had been doing. But if it's too difficult to check your blood pressure multiple times a day, which is completely understandable, you could check it at various times, say 3 or 4 times in a week. And over time, you might still get some pretty good data. typically, when we have patients do office blood pressure measurements, we do confirm it with ambulatory measurements, as I mentioned above. And these will be 5 to 10 points or millimeters of mercury lower than the office measurements. Isn't that interesting? So you might have heard of white coat syndrome, where some people have an elevated blood pressure only in the office. But typically, almost all of us will have a bit of elevation to our blood pressure when we're in the doctor's office. Up to 20% of patients with high blood pressure in the clinic have normal ambulatory pressure, or white coat syndrome. Okay, so let's move on to evaluation. Assessment should focus on identifying complications of hypertension and comorbid cardiovascular risk factors. And that's a fancy way of saying, does the patient have a strong family history of heart attack or coronary artery disease? Remember, coronary artery disease simply means there's blockage or plaque buildup in the artery that feeds the heart muscle. Does the patient smoke? Does the patient have diabetes? These are powerful, strong risk factors for developing cardiovascular problems due to elevated blood pressure. The doctor should take a thorough personal and family history. So it does matter what your own history, medical history is, but it also matters what your family members have been diagnosed with. So please do go into your doctor appointment knowledgeable about what your family members have been diagnosed with, so that you can let the doctor know. You want to let the doctor know if there's a family history or you have a personal history of high blood pressure, coronary artery disease, heart failure, diabetes mellitus type 2, or elevated cholesterol. Also elevated triglycerides. You do want to let the doctor know when you see him or her what your prior treatment has been, whether or not you've been on any medications, whether or not you've been allergic or to any medications or have had an adverse event. And then also, please do let your doctor or provider know specifically about your lifestyle habits. Let them know what foods you have in your kitchen, what foods you typically eat. Be honest. And then also, please do let them know what your exercise routine is, if any, how you sleep, and make sure to be detailed about that. And let the doctor know about your use of alcohol, whether or not you've ever even used tobacco, if you have or do use tobacco, exactly how much. Typically, the doctor will perform a physical exam in the office, and they'll ask you some other questions as well. Okay, so now we're going to get to laboratory testing. So typically, we doctors do want to do an electrocardiogram or a simple EKG in the office if you have confirmed hypertension or chronically elevated blood pressure. And we'll also want to take some blood and do some urine testing. There's another test that we can do. I pretty much call it cardiac risk calculator, but you'll see it named differently in the literature, or if you search the internet, you might see it listed as ASCVD risk estimator. Typically, I'll tell the patients to go to American Heart Association website, but there are multiple different websites that have good calculators. You can go to the American College of Cardiology.org. You can go to familydoctor.org. But if you just do a basic search for American Heart Association, if my recollection is correct, on the home page, there will be a cardiac risk calculator. If you enter in all of your data, which typically includes your most recent blood pressure, your most recent LDL cholesterol, which is the bad cholesterol level, your most recent HDL cholesterol, which is the good cholesterol level, whether or not you smoke, whether or not you have diabetes, etc., then you hit calculate, then you'll get a percentage result, and it might be something like 10% or greater than 10% or less than 10%. And usually if it's greater than 10%, your doctor or provider will recommend certain medications to reduce your risk of cardiovascular outcome. Basically, that percent result is indicating to you what risk you have to have a cardiovascular event such as a heart attack or myocardial infarction in the next 10 years. And then just to be specific, I did mention the EKG. We typically want a 12-lead EKG. Not something you really have to worry about. Most of us doctors' offices don't do a 2-lead anymore. It's usually just a 12-lead, so you shouldn't have to worry about specifying that. A blood glucose level, a hematocrit level. Now we typically do that with a CBC, which is the abbreviation for complete blood count. Lipid panel, which is the name of the cholesterol panel. That's how patients usually say it, and it almost always includes the most important cholesterol levels, which are the LDL and HDL, but there are other cholesterol levels and fat molecules that we do monitor. Calcium level, that's usually included in a basic metabolic panel or a comprehensive metabolic panel, and something we typically order. Creatinine and glomerular filtration rate, that's typically included in a basic metabolic panel and of course in a comprehensive metabolic panel. Potassium level, that's always in a basic metabolic panel and of course in a comprehensive metabolic panel as well. In a urine test, we'll be looking for evidence of protein in the urine, not gross protein that you can see, it's microscopic. Microalbuminuria. Okay, so I am going to actually stop the video here. We've gone on for about 16 minutes, and I will continue the video series on hypertension with a third video that will be coming soon. So if you don't want to stay tuned for the spiritual information, this is the time to click away. But first, please do like and subscribe. So with the spiritual information, what I typically like to tell the viewer is that I am a devout Christian. I believe that we are lost and we do need to be saved, that salvation is important. I've written a book. My first book is called You're Saved, and you can get it at Amazon. Please feel free to go into my YouTube channel and look at the pertinent website addresses for information, including my author website. And I also typically want to tell the viewer that I've been practicing medicine almost 25 years, and I have noticed anecdotally that patients who have a spiritual discipline, a religion, or even close family ties seem to do better medically. They seem to have better medical outcomes, and the scientific literature does support that to some degree. And then